I'm Dr. Jim Daniel, and today we're going to talk about knee pain. Knees are one of the most common sports injuries there are in America. Whether they are degenerative in nature, runners, or whether they are acute injuries such as soccer or football players getting hit in the knee is one of the most common sports injuries. There are 5 basic structures for the knee. There is the anterior cruciate ligament, which runs deep, front to back, the posterior cruciate ligament, which runs from back to front. There is the medial collateral ligament, which is on the inside of the knee, the lateral collateral ligament, which is on the outside of the knee, and the meniscus, which is inside the knee in between the 2 bones. We also have a patella, or the kneecap, which sits right on top. General rule of thumb for diagnosing knee injuries: if it hurts going uphill or upstairs, it is usually muscular or tendon in origin. If it hurts when going downhill or downstairs, it is usually a problem inside the joint itself. That's just a general rule of thumb. It is not a hard and fast rule. The kneecap, or the patella, is unique in that it is a floating bone inside this big tendon formed by your thigh muscles or your quadricep muscles, and attaches below to the lower leg to the tibia. And it floats in that tendon and it slides in and out of a groove. And one of the most common causes of knee pain is when this kneecap jumps track and does not slide in that groove correctly. It can cause grinding and acute pain in your knee. One of the best things we can do, no matter whether you have a tracking issue of the kneecap or whether you have an injury to the meniscus or one of the major ligaments of the knee, is stretching. So we want to make sure that we keep the knee stretched out. It will also help move around any inflammation inside the knee joint itself. So stretching the knee is fairly simple. All you need is a wall. Can I have you stand? All right, we'll start by stretching the calf muscle. The calf you're going to stretch stays back, then you'll take another step towards the wall, keeping the right leg straight with the heel against the wall, and bend the left knee and stretch that calf muscle. Hold it for 10 seconds and then back up, and then you'll swap legs, keeping that heel down, and you'll stretch that for an additional 10 seconds, back up, and you do each stretch twice. Next, we want to stretch the quads. So one hand on the wall, bring the other knee behind you, grab the foot and just hold 10 seconds, back down. We'll do the other leg for 10 seconds, back down, and you do each side twice. Next, we're going to do a straight leg toe touch. So with the knees straight, toes pointing forward, you're going to bend down and stretch as far as you can without increased pain, holding for 10 seconds. Back up, 10 seconds rest, and then do it again. Repeat an additional 10 seconds. And back up. Sometimes patients, for whatever reason, cannot perform these stretches standing. So one of the easy things to do is to lay on your side. You can do it in bed. You start by stretching the quads. You bring your side leg up and then bring that knee down. That'll provide a good stretch if you're not able to do it standing. Another one, back down. Another one is to stretch the hamstrings seated on the floor. Toes pointing up, chin tucked, lean forward as far as you can. Again, the goal is not to touch the toes. The goal is to get a good stretch of the hamstrings. Relax for 10 seconds, and then you'll repeat it again. And back up. Hold each stretch 10 seconds. Perform each stretch twice to each side. Stretch within the pain-free range of motion only. And remember, you always want to start with the most basic and then progress to more advanced maneuvers. If you have any questions about this or any other issues, call me at the office, 615-494-1125.